How do you do? My name is Dr. Vogelgesang. I'm here to discuss treatments for painful diabetic neuropathy. I do want to remind you that this is a neuropathy is a neuropathic pain, and the diabetic ones are the ones that we focus on in this particular lecture. There are other types of neuropathies like chemotherapy-related neuropathies, also idiopathic neuropathies, and any other types of neuropathic syndromes may likewise respond well to a Nevro high-frequency spinal cord stimulator. A little bit about me. I'm American trained addiction medicine is my most recent board certification. Also board certified in anesthesiology. Did my residency training in Oregon, internship in Tennessee, and most of my formal medical training down in Texas. The reason I wanted to focus on diabetic peripheral neuropathy is it's one of the more common ones in the United States of America. Approximately 10% of our population, or 34.2 million people, have diabetes, and 1 in 5 don't even know that they have the diabetes. When you're diagnosed with diabetes, you run the risk of having a diabetic peripheral neuropathy. In the United States, that number is about 5.3 million persons. And of that 5.3 million people that do suffer with painful diabetic neuropathy, almost half of them have failed conventional medical management. Conventional medical management include things like the anticonvulsants. Most of us who've been in this field for very long are very familiar with gabapentin and pregabalin. There's also the SNRIs, which are antidepressants. Most common one used today is duloxetine. The more conventional use is the tricyclic antidepressants, such as amitriptyline or tryptamine, disipramine, etc. That group has been around since the 60s at least. And then, of course, formal pain medications, things like the opioids, oxycodone, tramadol, etc. Other types of conventional treatments for diabetes include the topical treatments. Most common is the capsaicin. And then other treatments include such things as formal physical therapy and transcutaneous electrical nerve stimulation. Typically, when we talk about pain, we're referring to a visual analog scale, which usually runs between 0 and 10, 0 meaning no pain, and 10 being the worst possible pain you can imagine. The issues with conventional treatments are quite many. One of them is simply remembering to have the treatment. You got to make your physical therapy appointments, remember to turn on your TENS unit, remember to apply your topical treatments, remember to take your medications. These things seem kind of simple and just a once in a while have to do activity, but typically on a day-to-day basis, patient compliance with medications is very, very low. Just as a brief aside, if you and your dog both get cancer, you are more likely to make sure that your dog gets his chemotherapy treatments and chemotherapy medications better than you are to treat yourself. That's already been a study that's already been done. You're welcome to look it up, but remembering to take your medications is truly a very difficult thing to do. Hence, we get a lot of failure with conventional treatments. Another issue is most of the medications we use in treating diabetic peripheral neuropathy result in weight gain. And do we need more help in being obese? Most of us don't. Next is these medications tend to cause brain fog. You can't remember when you come up to a stoplight if red means stop or go. Not something I'm making up. I actually hear that complaint from my patients. The other issues is most medications we use to treat pain also cause sedation. And then lastly, some of them are associated with nightmares or night terrors. When we talk about spinal cord stimulators, it's very important for us to understand what exactly are we talking about. Today, the focus is on the Nevro high-frequency 10,000 kilohertz device. This is a very small device that works inside your body to disrupt pain signals to the brain. The device is placed like an epidural injection, same-day type surgery, usually in the office as an outpatient procedure, and it's usually only a 1-week temporary trial. You get the device placed, you walk around for a week, decide if it makes a difference in how you feel. There are 2 different types of spinal cord stimulators on the market today. One is the traditional stimulation, which is through companies like Medtronic, Boston Scientific, and St. Jude or Abbott. These usually operate between 2 and 1200 hertz, and this has been shown to be safe over the past 40 years. The newer device is a 10,000 hertz stimulation. It's also known as high frequency. The only device in the market today that is FDA approved as high frequency is Nevro. And this is FDA approved to deliver superior pain relief versus traditional spinal cord stimulators. This delivery of superior, as approved by the FDA, is not a small notation. It's actually one that should be in billboards with flashing lights. To get a superior rating by the FDA means that your device is significantly better than any other device on the market that calls itself the same thing. There's only one device in chronic pain that has a superior rating, and that's Nevro HFX spinal cord stimulators. There are only a handful of devices in modern medicine today that have a superior rating by the FDA. So this is not a little thing, this is a huge thing. And if your doctors aren't using Nevro, then you should ask them why. Because the superior rated device is Nevro, not Medtronics, not Boston Scientific, and not Abbott. Spinal cord stimulators is a well-established approach to managing chronic pain, and there are many unique benefits with this device. First of all, it's drug-free and hence addiction-free. It's also a minimally invasive procedure. It does not require any major surgery. You can try it before you buy it, which how many of you have spent $250,000 on back surgeries that if you'd known what was going to happen, you sure wouldn't do it again? Can you try your back fusion? If you don't like it, give it back to the surgeon in a week? No. But with this device, you can try it. If it's working, great, work toward implant. If it doesn't work, hand it back to me. I'll throw it away. We're done. We won't discuss it again. The other thing to recognize is that success is defined at a fairly high bar. If we consider a successful trial, we go on to implant. A successful trial is defined as at least a 50% reduction in your pain and an improvement in your activities of daily living. Well, what does 50% mean? That means if you are suffering with severe pain at an 8 out of 10, if your pain isn't at least down to a 4 out of 10 or better, then you don't qualify to have it implanted. That is a big statement. If you saw a 50% reduction in your spending income, you would notice. If you saw a 50% increase in your weight, you would notice. 50% is a very big number, and it's something that is very respectful in this particular device. We'll have more to talk about that in the next few slides. The FDA has classified Nevro as superior versus traditional stimulators. That's we just talked about. Medicare has designated Nevro to be wholly separate and distinct compared to traditional stimulators. It actually has its own CMS codes. I mean, not just the FDA, but also Medicare, the largest human insurer in the United States of America, says that, hey, we recognize Nevro is very different than traditional spinal cord stimulators. In fact, if you have a traditional spinal cord stimulator and it fails, Medicare will pay for you to have a Nevro spinal cord stimulator trial, because that's how good they think they are. So if in doubt, please try the Nevro. Every major insurance carrier in the United States of America covers it. So far, well over 100,000 patients have been treated successfully with HFX solution since its inception. It did not exist prior to 2013. It was first tried in Australia and in Europe. And then in around 2015 and a half, they began marketing it here in the United States. It is a relatively new device on the market. It is the newest spinal cord stimulator in the United States of America. Again, as mentioned earlier, Nevro is not addictive. It doesn't cloud your thoughts, doesn't cause drowsiness or constipation, like the medications can. Only Nevro can deliver traditional stimulation and 10,000 hertz therapy. So if you like to feel your paresthesias, you'd like to know that this thing is working, I can understand that. One of my cars is a hybrid, and sometimes I don't even know if it's on. It's so quiet. It's kind of nice to hear an engine every once in a while, so I know it's running. So I can understand why some people might want to feel some paresthesias, which is how you use traditional spinal cord stimulation. This device, Nevro, can do traditional stimulation as well as high frequency. You can have the best of both worlds. You want to know where it's working, when it's working, we can program in traditional stimulation. If you want to get rid of the pain and not feel anything, we can do high frequency. There's no reason to use any other stimulator than Nevro. The paresthesia independent is what makes the high frequency spinal cord stimulators the best. In the past, everything had to be mapped out with stimulation with the traditional stimulators. We bypassed this with the Nevro. And unlike traditional stimulators, high frequency Nevro stimulation can be used 24/7. Typically with traditional stimulations, they recommend you turn it off while you're driving because they don't want it to cause your body to jerk or go into spasm if you're trying to use the brake or the gas pedal. And likewise, it can wake you up from sleep. If you turn or shift a certain way, it might move the lead too close to the cord, causing any sudden spasm. So the time when you're trying to use it the most, which is when you want to go to bed, you're supposed to be turning it off so that it doesn't wake you up during the night. Again, you don't have that issue with high frequency stimulation. And also, as mentioned earlier, you can try it before you buy it. You have a trial. If it's successful, you'll go ahead and want to implant. If you try it and it's not giving you what you want out of your life, don't spend any more money on it. And the cost difference between a trial versus an implant is about tenfold in my office. So that's a pretty big chance you're taking if you go ahead and go straight to implant. But imagine the potential cost savings. You try it, you don't like it, you're done. So that's a pretty awesome deal. Also, prior to even considering the trial, we'll go ahead and get you a idea. It's kind of like a cost beneficiary. What is your expected cost based on the type of insurance you have? How much would you have to put out? That's done for everybody prior to during the authorization process of getting a Nevro. So you're going to know, is it going to be $50 out of pocket? Is it $500 out of pocket? What's it going to cost you? That's a special service through Nevro. And the trial procedure, that little device you see, the little blue and white one with a little adhesive around it, that is the actual trial stimulator. That's taped on the side of your body. Those two little blue things coming out are leads. And those leads go up into the epidural space. And as noted here on line number 3, it's like a wet spaghetti noodle. It just slides up into the epidural space. We follow it under fluoro and we put it where it needs to be to give the stimulation to reduce your pain. For example, if you have neck and arm pain, it goes in the cervical spine. If you have low back pain, it goes into the mid-back area, probably around T9, T9-10. If it's down in the feet, it will be around T11. You have to remember the spinal cord typically stops around T12L1. This is a spinal cord stimulator, not a peripheral nerve stimulator, and not a spinal nerve stimulator. So it has to be above T12L1 to give cord stimulation. The other thing is, once we put in these temporary leads, you'll walk around, do your things for about a week. And if you like it, you're going to want to go ahead and have it implanted. My experience is about 9 out of 10 patients usually have a life-changing benefit with a spinal cord stimulator trial and want to go on to implant. The focus on this lecture is painful diabetic neuropathy. This is a very good slide which shows your conventional medical management, which is going to be the gray ones, CMM. The blue one is your high frequency stimulation, and then your yellow one is your crossover. As you can see with conventional medical management, the gray one, we try our gabapentin, we try our Lyrica, we try our tricyclic antidepressants, our duloxetine, our topicals, and we get very little success. Pain started around a 7.1 or 2, goes down to 6.5 and back up to a 6.9. That's no significant improvement in pain relief, and that's a failed medical management. We put in a spinal cord stimulator and notice how quickly their pain goes from the mid-7s down to the mid-2s. That's within just a few weeks of therapy. They're already down to the mid-2s. And look where they're at 6 months, down to a 1.7, 12 months they're at 1.7, 18 months they're at 1.7, 24 months they're at 1.4. There is no other device in the world that performs like this for painful diabetic neuropathy. Let me say that again a little bit slower. There is no device like this in the world that treats painful diabetic neuropathy this effectively. This is what we call the home run. Now, sadly, it does not work for everybody. Why? I don't know why. There's hardly ever anything in the world that works 100% all the time. But this device has given us the best outcomes in the history of medicine for painful diabetic neuropathy. And just to make sure that this was like a real thing, notice how they took the ones who were failing the crossover. They were failing the conventional medical management. So we put them in that yellow column coming down. Notice how the actual numbers, the actual angles pretty much parallel each other. That blue line is nearly parallel with the yellow line, meaning even though you have failed medical management, when we treat you with this spinal cord stimulator, you get the same effect with or without prior medical management. You still get your pain levels down to mid-2s, upper mid-2s, down to the 1.9s. Is basically the same. The difference between a 1.7 and 2.1 is not a statistically significant number. So basically you get the same outcomes, which is excellent pain relief clear out to 24 months. There's not a single device in the world that can do better than this device for painful diabetic neuropathy. And then here's another one. It shows neurological improvement compared to baseline. And again, there is another device that's FDA approved to treat painful diabetic neuropathy. It is not half as good as this device. And when it looked at outcomes neurologically, it failed. There were no neurological improvements over time. This was not something that we had ever expected with this device. But look, with HFX, look what happens in 3 months, 6 months, 9 months, 12 months. Look at that improvement. Within 3 months of a spinal cord stimulator, we're starting to see improvements in neurological outcome. People can actually feel their feet better. They can actually have better 2-point discrepancy. When we do biopsies of the muscles, we actually see more proliferation of nerve fibers in that same area of tissue 3 months later, 6 months later, 12 months later. This is unheard of, that you can treat a pain condition and get an improvement in their neurological status. This is something unheard of in medicine. It's something we should be bragging about a lot more. This device is good. We should be more passionate. So for painful diabetic neuropathy and quality life improvements, not only do you enjoy significant pain relief, 86% of the people enjoying long-term pain relief with this device. 86%. 62% report sleeping better. And for those of you who have painful diabetic neuropathy, you know your pain is always worse at night. You know it's always hard to get a good night's sleep, and you're always constantly tired during the day. Wouldn't it be nice to sleep better because you have better pain control at night when you really need your best pain relief? And you also get improvement in sensations. The amount of nerve fibers in a particular area of tissue increases over time. You actually can walk more normally. You're not walking like a robot. You can now feel proprioception. You can tell where your feet are. Your strength improves, your reflexes improve, sensory function improves. This is phenomenal. And my last one, which is my most favorite on this page, 92% of the patients who had high-frequency spinal cord stimulation treatment for their painful diabetic neuropathy were satisfied with their treatment. 92%. I have yet to meet the doctor who says that he loves 92% of everything about his life. I have yet to meet the patient who loves 92% of what they deal with in their life. I've yet to meet the group of people that say, of that group, 92% say they love their spouse, they love their car, they love their house, they love their president, they love their income, they love their taxes. 92% satisfaction is unheard of. This is a huge number, and that's what we're getting results from in studies asking patients, do you like this device? Excuse me. Nevro versus Medtronic. The reason this trial is against Medtronic, and I don't necessarily mean to say against, is with Medtronic, is Medtronic is the largest spinal cord stimulator company in the world. It has been in existence longer than any other spinal cord stimulator. I think it began its implant processes back in 1984. Boston came out next in 2005. I think St. Jude came out in 2007, and Nevro came out in 2015 and a half here in the United States. So, I mean, Medtronic has been around forever. And so comparing things to Medtronic is just like comparing things to the original, the one who set the bar. And Medtronic set the bar, and then Boston and St. Jude are considered traditional or equal to Medtronic. Nevro is trying to prove, hey, we're better than any traditional one. And this is some of the papers that they presented in order to show, hey, we deserve a superior rating because we are superior to any traditional stimulator. And this is what helped them to get their FDA rating as superior. Now, this is an RCT trial, which I'll talk a little bit more about trials coming up. But an RCT is a random controlled trial, and that is considered a level 1 study, which is the highest, most sophisticated study you can do when evaluating anything in the world. If it's a RCT, that's a level 1, that's a high quality study. So Medtronics have a 6-month study with a number of 17 patients. Wow, that was a huge number. And notice 53% said they had improvement in daytime relief of at least 50%, and then 47% said they had 50% improvement. That's barely met criteria of a 50% improvement overall in pain relief. And then we go to their 24-month studies. Notice 2 years out, neither one, nighttime or daytime, met the 50% requirement. So technically speaking, that's called a failure because they did not meet the 50% level of pain relief you have to call yourself a success. So, okay, 24 months it failed. And I've been doing spinal cord stimulators for decades. And I can tell you one of the big jokes in medicine was, oh yeah, put in a spinal cord stimulator, you get paid for that. And then it doesn't work anymore after a year, you take it out and lo and behold, you get paid for that too. So that was the big joke. Oh, spinal cord stimulators. I was never a big spinal cord stimulator implanter or trialer back when I first started medicine because they were just nothing but failures. And then look at their 5-year one, 20 and 17%. Again, huge drop off. So again, Medtronic, the best device, the hallmark, the gold standard of spinal cord stimulators, failure. After 24 months, failure. And look at Medtronic, look at Nevro. Nevro has a 6-month and an 18-month. Why do they just have a 6-month and 18-month? Because that's all the data we could put together in the last few years. And so look at their 6 month, 83% got at least 50% pain relief. And look at the 18-month, 86%. Doesn't even compare to what Medtronic was able to prove. So again, this is what helped give Nevro that superior rating versus traditional stimulators. Here we have reported neurological improvements for PDN. Medtronic is approved for PDN, but they have no study showing any improvement in neurological status. And trust me, if they could, they would want to prove that because they want to prove that they're as good as Nevro. They're not. And their study to show that they could have PDN was not an impressive study either. Again, Nevro, 2 out of 3 people show improvement in neurological status with use. Unheard of, unbelievable, unexpected. We are very pleased. And trust me, if you're going to consider a spinal cord stimulator, I would definitely be considering Nevro. Experience in my practice, about 95% of my patients who have painful diabetic neuropathy and go on to have a trial, go on to have it implanted. And that 95% that's a phenomenal thing. There's very few things in my practice that I can say, yes, 95% of my patients reported at least 50% improvement in their functionality and pain relief. So please do consider this device as superior and excellent if you're considering treatment for painful diabetic neuropathy. It does work for other neuropathies. This study, however, is focused on the diabetic one because it is one of the bigger, more profound neuropathies here in the United States. And then Nevro for PDN, who's a good candidate? This is based on a study with Erica Peterson. What were her criteria when she did her study? And she's the one who did the census study with the, let me see, this was the PDN study of around 250 some odd patients. And what was their criteria for who met, who was going to be a candidate for spinal cord stimulation? They had to have a hemoglobin A1C less than 10, a body mass index less than 45, which, by the way, ideal body weight's around 21. And despite trying medications for PDN, they still had suffering, debilitating pain, and they wanted better quality of life. And of course, you have to have the diagnosis of a painful diabetic neuropathy as well. In my area, you may have a hemoglobin A1C of less than 10 to have a trial, but I cannot do an implant unless your hemoglobin A1C is less than 8. There's not a facility that I work at that allows me to take a patient to the operating room for an elective procedure with a hemoglobin A1C over 8. So that one I can do a trial, but I cannot do an implant in this area because it's not allowed. These are just a couple of case reports of people who have had life-changing experiences with the Nevro, who suffer with painful diabetic neuropathy. I hope you'll spend a moment reading these because these are impressive. I really like the one about the gentleman who said it was a life changer for him. His demeanor's changed, all for the better. He feels like he has a future. He wants to live. He wants to spend time growing old with his grandchildren. I meet a lot of sad people in my job. I do chronic pain, and I love it when I can turn people's lives around and give them something that is worth living for. And this is certainly a device that has been a life changer in my clinic. And then conclusions, painful diabetic neuropathy affects a large population with a limited treatment option. And frankly, those limited treatment options have been pretty unsatisfactory in the many decades of my career. This has changed now with Nevro. Nevro is unique. It has a mechanism of action that we don't 100% understand, but we do know the outcomes are excellent. Nevro has an FDA classification as superior to all other spinal cord stimulators in the United States of America. It has a superior classification. And again, they don't hand those things out. You have to earn them. This is the only device in chronic pain that has a superior rating, and only one of a handful in medicine today that has a superior rating. You have to earn these. These are incredibly hard to prove. Nevro was able to do it. And there's a trial system allowed. So you first try it. If you like it, then we'll go ahead and do the implant. If you don't like it, we won't do it. And wouldn't that be nice if all surgeries and all procedures, we could do a trial first, see if it's going to be effective before we actually do the big thing and put it in your body and make it permanent. The other thing is about 9 out of 10 patients will choose to move forward with the implant. This is a very successful thing that goes from trial to implant. If you do have any interest to discuss this further, I'm certainly happy to talk to you. There's also a name at the bottom, Rod Snope. His cell phone number is there. Please contact him if you have any other additional questions. He's definitely a guru on this device. Thank you very much.